Hello guys, this is Dr. Ajinkya here. In today's lecture, I'll be discussing about the dural venous sinuses. Now, why is this topic so important? Now, this is important for those students who are in the first year M.B.B.S, also for those who are exam going for E.N.T residents final year, and those who are skull-based surgeons working along with a neurosurgeon, so where they normally deal with a lot of brain tumors at the skull base. So the anatomy of the dural venous sinuses is really important for these guys. So being a skull-based surgeon, I would like to definitely clear the concepts of the dural venous sinuses with you guys. So I'll be talking about in brief about the anatomy of the sinuses, its clinical significance, and what exactly is the communication pathway of all the sinuses, and eventually where they drain into. So let's start. As you can see on the screen, you can see the anatomy and the communication between the venous sinuses. Now you can see over here, this is the superior sagittal sinus, as you can see over here. Now this is the area of the falx cerebri. So above is the superior sagittal sinus, below is the inferior sagittal sinus. So at the upper and the lower end of the falx cerebri, you can see the superior and the inferior sagittal sinus. Always remember that. Now, the superior sagittal sinus terminates over here at the confluence of sinuses. Similarly, the inferior sagittal sinus ends and joins with the great cerebral vein to form the straight sinus, and the straight sinus joins with the confluence of the sinuses. Okay, so that is the rough part you have to always remember. Now, moving on from the confluence of the sinuses, we can see a sinus going directly on the lateral aspect. Now this is a sagittal scan, that is why you're seeing it to be coming as forwards. But if you see overhead view, you can see this as a transverse, it goes laterally. So this is a transverse sinus over here, which eventually ends up into the sigmoid sinus. Now the sigmoid sinus is a S-shaped sinus, which receives communication from the superior and the inferior petrosal sinus, and eventually the sigmoid sinus drains into the internal jugular vein through the jugular bulb. Okay, now these superior and the inferior petrosal sinus, they come from the cavernous sinus, which is right over here along the sphenoid sinus lateral wall. So this is the basic communication of the dural venous sinuses, which you always have to remember. Okay, now moving on to the anatomy in short, very short. Now the definition, you should remember that these are nothing but a collection of venous blood or venous pool, which is nothing but a venous channel which is found between the two layers of the dura. Now we all know that there are three meningeal layers, the outermost being the dura, the innermost being the pia, and an intermediate called as the arachnoid. And immediately under the arachnoid we have the subarachnoid space, which has got CSF, from which the projections you can see over here, the arachnoid granulations, they project into these dural venous sinuses for the CSF drainage back to the circulation for recirculation. So second important point, you have to remember that these are valveless. Okay, the dural venous sinuses are valveless, they do not have any valves, so there is always a bidirectional blood flow. So if there is a raised intracranial pressure, in that case the blood flow may get obliterated and the blood may flow in the opposite direction, causing edema. Okay, so what is the basic function of all these dural venous sinuses in common is that they receive blood from the cerebral veins for drainage. They receive the CSF, as I said, from the arachnoid granulations, from the subarachnoid space. They throw the CSF into the sagittal sinus for recirculation and mainly empty into the internal jugular vein eventually. So one more thing you have to remember, that the walls of these sinuses is very much composed of a periosteum and a dural reflection, so which both are lined by a single layer of the endothelium. Okay, so it is lined by the endothelium. So these 2-3 points are really important from the anatomical point of view and the histology point of view. So you have to remember this diagram and these 2-3 points, which are really important. Now the second thing is the classification. Now there are two types, one is this and the second one is this. So the first one is kind of complicated, so it depends on 4 categories depending on the position. So there are 2 anterior, 3 midline, 2 posterior, and 4 lateral. If you refer to this diagram over here, we can see the anterior group consists of the Sphenoparietal Sinus, the cavernous sinus. The midline consists of the inferior, the superior Sagittal Sinus, the straight sinus, and these three. The posterior one, though in midline, is the posterior one is the Occipital Sinus and the confluence of the sinuses. The lateral ones include the Transverse Sinus, the Sigmoid Sinus, the superior and the inferior Petrosal Sinus. Now, the more easy one is the classification depending on the number, that's the unpaired and the paired. So if you refer to the same diagram, you can see the superior, inferior, straight, occipital, and the intercavernous. Now, those sinuses which are in the midline are always single, and those sinuses which appear on either side along the midline is definitely going to be paired one. So you can refer to this diagram and have this classification and this classification in the exams if they ever ask you the question. So moving on to the very first sagittal sinus is a superior. Now, you don't have to write this in detail, you just have to remember a few important points. Now, the superior sagittal sinus is the largest sinus in the brain. That's the first point. Second, that you can write it is a unpaired as it is a midline structure. Now, you directly have to write the origin. Now, the origin is at the junction of the frontal and the ethmoid bone, which is directly posterior to the foramen cecum near the crista galli. As you can see, this is a superior sagittal sinus. It originates at the anterior ethmoid and the frontal bone, and it's the largest dural venous sinus. Now, from the foramen cecum, it may vary or about 1 to 12 mm in the origin. So the neurosurgeons should be very well aware of this variation in the origin to prevent any undue hemorrhage and trauma. So we all know that the next point we should write is that it starts anteriorly, goes posteriorly, and terminates in the confluence of the sinuses. As I showed you over here, it starts over here and ends in the confluence of sinuses. Now, the second point, third point, we all discussed the anatomy, the origin, the termination. Now, moving on to the function, the same function, that is the CSF homeostasis, blood recirculation, maintenance of the intracranial pressure. So that is basically the functions. Now, but what is special about the superior sagittal sinus is that it has got the highest number of the arachnoid granulations, which give a lot of CSF into recirculation in this area. And it drains the lateral aspects of the anterior cerebral hemisphere. So this is the point, these are the points you have to remember for superior sagittal sinus. And if at all they ask you the clinical significance, you always have to remember that as it is the largest dural venous sinus, it is more prone for surgical trauma, accidental trauma. So it is also more prone for thrombosis, presenting with headaches, hemiparesis, 6th nerve palsy, papillary edema as in raised ICT, nausea and seizure. Now, you must have seen a female who eats a lot of, contraceptive pills, OC pills. They are really prone for a stroke because it leads to thrombosis in case of superior sagittal sinus, which may lead to loss of consciousness for a few days to weeks. So that you have to prevent. That point is very important. Also, if a patient or a person has a previous history of thrombosis, malignancy, or any blood clotting risk factors, they are really prone for the superior sagittal sinus thrombosis over here. As you can see over here, this is a superior sagittal sinus. That's the arachnoid granulations, middle meningeal veins over the superior aspect. Also, the dural arteriovenous malformations you can mention, and the raised intracranial pressure. Now, when there is a raised intracranial pressure, the sinuses get obliterated and may cause a retrograde flow, which results into a lot of edema. So these are the points you have to mention in the exam whenever it comes. Now, the inferior sagittal sinus is the same thing. You just have to mention the origin, its pathway. The origin is on the inferior aspect of the falx cerebri, or you can say its origin has to be at the near the genu of the corpus callosum. It runs over the superior aspect of the corpus callosum and terminates into the straight sinus with the union of the great cerebral vein. So you can keep it short, okay? So you can write now what areas it drains into. or it drains from. So it drains blood from the medial cerebral hemisphere, the falx cerebri, the corpus callosum, cingulate gyri. Okay, so they all drain into the straight sinus. As I said, now this is the point where the anatomy is explained, so you can have a good thorough read. You can take a screenshot of this. Now moving on to the third one, which is a straight sinus. Now we read about the superior and the inferior sagittal. Now we have the straight sinus. Now the same points you have to mention again and again. There are only few specific points you just have to change. Now in case of the straight sinus, we see that it is found at the junction of the falx cerebri and the tentorium cerebelli. So as you can see over here, this is the falx cerebri and this is the area of the tentorium cerebelli, which we see the straight sinus right there. So the second important point is that it ends at the confluence of sinuses, where the superior sagittal sinus terminates. And also, you have to remember that not always the straight sinus will end in the confluence of sinuses or the superior sagittal sinus. It may sometimes end into the left transverse sinus or sometimes into the right transverse sinus directly. So sometimes a patient may have an absent straight sinus. So in that case, you can see a persistent falcine sinus, which is a sinus in the falx cerebri itself, which is directly draining into the superior sagittal sinus. Okay. So this is what you have to always remember about. Now, the sphenoparietal sinus. Now, what do you mean by a sphenoparietal sinus? Now, many people do not know about this sinus. Now, earlier studies used to mention that the sphenoparietal sinus is nothing but a continuation of the superficial middle cerebral vein. You can see over here, that's the sphenoparietal sinus, which is a paired sinus on the lateral aspect. And you can see over here, that's the superficial middle cerebral vein. But new recent studies have shown that it is a combination of two structures, which is the parietal portion of the anterior branch of the middle meningeal vein and a dural channel located under the lesser sphenoid wing. So you can see over here, this is a sphenoid body, that's the lesser wing. Under that, you can get a sinus, and there you can get an anterior branch of the middle meningeal vein. So the union of those two forms the sphenoparietal sinus. If you go for a MR venography, you can see that's the superficial middle cerebral vein, which has got no connection whatsoever with the sphenoparietal sinus over there. Okay. So that's the cavernous sinus, that's the middle meningeal vein, that's the superficial middle cerebral vein, and that's the sinus of the lesser wing of sphenoid. And the junction of the middle meningeal vein and the sinus of the lesser wing of sphenoid has a junction over there, which results into the sinus of the sphenoparietal sinus. So you can use an MR venography to confirm that. So that is all about the sphenoparietal sinus. The functions and the clinical importance always stays the same as compared to the others. So next is the superior petrosal sinus. Now, this superior petrosal sinus, what you have to remember is that it drains from the cavernous sinus. As you can see, this is the anterior posterior sagittal orientation. You can see that's the cavernous sinus over there of the left side. Posterior superiorly, a branch comes off, that's the tributary comes off, and that's the superior petrosal sinus, which enters into the transverse sinus and continues into the sigmoid sinus. Okay, so this is posterior superiorly. The superior petrosal sinus, as you can see over here, drains from the cavernous sinus. That is what you have to mention. Then you have to mention the anatomy. The course of the superior petrosal sinus is as follows. The sinus originates in the cavernous sinus. Here you can see the cavernous sinus, and leaves the posterior superior aspect of the cavernous sinus, then runs caudally between the third and the fourth cranial nerve. Now that's a very important point. And this sinus then joins with the transverse sinus. As you can see, this is a straight sinus, that's the confluence, and that's the transverse sinus. So here it joins the transverse sinus, and there is the beginning of the sigmoid sinus. Okay. So the tentorium cerebelli is attached to the edges of the superior petrosal sinus, is one more important point. Now the function remains the same. That is the homeostasis of the CSF, the blood recirculation, and same thing. So the fluid then empties into eventually the systemic circulation. Okay, the internal jugular vein and the superior vena cava. So same thing, clinical significance, the same thing you have to remember: homeostasis, then trauma, then thrombosis, then carotid fistulas, arteriovenous fistula malformations in the dural venous sinuses. You can see, for in this case, there are three types: type 1, type 2, or type 3. You can read all the types, and the treatment for this type 1, type 2, and type 3 is mostly the endovascular therapy, transvenous embolization, which is a non-surgical treatment of choice. If it's not working, you can go for a gamma knife radiosurgery. Okay, so this is what you have to remember about the superior and the inferior petrosal sinus clinical significance. Now moving on to the inferior petrosal sinus. The inferior petrosal sinus is one of the dural venous sinuses, as we all know. Now what is so special about this inferior petrosal sinus? It's all the same. It comes from the cavernous sinus, posterior inferiorly, runs posterior laterally. It drains into the, as you can see over here, it drains into the lowermost aspect of the sigmoid sinus. Into the, then the sigmoid sinus will turn, eventually the drainage will happen in the jugular bulb, and the jugular bulb continues as the internal jugular vein. So it's the same thing roughly for all the petrosal, superior and the inferior petrosal sinus. So the extra thing you have to remember is that apart from the cavernous sinus, it drains from the tributaries from the medulla oblongata, pons, and the inferior surface of the cerebellum, as well as the labyrinthine vein, that is the cochlear canaliculus, and the vestibular aqueduct. So there are few specific points for all the sinuses which I have mentioned, so you just have to go through. So make a tabular chart for the common points you can see, and make a tabular chart for all the unique special points you see in each dural venous sinuses. So that is going to give you an extra edge in the exams and the viva. So this thing you can see, there are two classifications for the inferior petrosal sinus. Now, as you can see over here, that's the inferior petrosal sinus, and the termination over either into the IJV directly or in the sigmoid sinus. So that's the classification all about. So the type 1, 2, and 3, and 4, this is the classification according to the Hsu et al. And this classification which was modified by the Miller. So you can see the type 1 says it drains directly into the jugular bulb. Second, it drains into a communicating vein that links to the jugular bulb. So it's an indirect communication. Type 3 suggests the poorly formed, the inferior petrosal sinus is represented by a plexus of veins. So here it is directly, here it is through a vein, here it is through a plexus of veins. And type 4 is that the inferior petrosal sinus drains directly into the deep cervical venous plexus. So from the exam point of view, this classification is really important. Now this one is just a modification by the Miller, so you can just take a screenshot of this and can read in detail. Now the next is the transverse sinus. Now transverse sinus, as you can see over here, this is an overview of the skull, cut surface of the skull. You can see the two paired lateral venous sinuses, that is the transverse sinus. Now as you could see over here in this section, the transverse sinus was this one. See, as I told you, it is moving laterally and not anteriorly here. So the same transverse sinus is visualized as like this. It moves laterally, okay? So it moves laterally and then anteriorly towards the sigmoid sinus over here, and then drains into the IJV. That's the inferior and the superior petrosal, that's the cavernous sinus. So same points, only few specific points you have to remember for this is the anatomy and the pathway. So the transverse sinus begins at the torcular hierophily, which is the connection of the superior sagittal, straight, and the occipital sinuses. The superior sagittal, straight, and the occipital form the torcular hierophily. The right transverse sinus is usually a continuation of the superior sagittal sinus, but the left transverse sinus is usually continuous with the straight sinus. So this is a very important point of the right and the left anatomical variation. Okay, the transverse sinuses course in the attached margin of the tentorium cerebelli, receiving blood from the lateral temporal surface, the basal surface of the temporal, and the occipital lobes. So this paragraph and this paragraph is really unique for transverse sinus. Rest all is the same. So one more extra point you can have is this also receiving the inferior anastomotic vein, that is the vein of Labbé. Okay, I'll show you the vein of Labbé over here. Okay, somewhere around here it was present. Okay, here you can see that's the inferior anastomotic vein of labia. You can see over here, and that is draining into the transverse sinus right there. Okay, you can see the transverse sinus right there, and that's the communication. You can see that's the inferior anastomotic vein of labia. So this is the most important point, a unique point for transverse sinus you have to remember. Okay, so the right transverse sinus collects venous blood from the superficial part of the brain, while the left collects from draining deep parts of the brain. So that is also very important. The right is superficial, the left is deep. Now moving on to the favorite sigmoid sinus of all the ENT surgeons, lateral skull base surgeons, and the lateral skull base neurosurgeon is the sigmoid sinus. Okay, so now it is very short. Very few points you have to remember is the anatomy of the Trotman's triangle, the anatomy of the orientation of the posterior semicircular canal. That's it, nothing extra. Okay, you just have to remember it has a S-shaped course, and it drains from the superior petrosal, inferior petrosal, and eventually into the jugular bulb. So you can take a screenshot of this for a short note if asked in the exams for ENT surgeon, or a first year M.B.B.S, or a third minor student for E.N.T. Okay, so you can have a screenshot and read that in detail. It's a very short answer. So moving on to the next one is the occipital sinus. Now occipital sinus is a posterior most aspect, a single your unpaired one. As you can see in this diagram, you can see that's the transverse sinus moving laterally and anteriorly, eventually getting the sigmoid sinus. That's the jugular foramen, jugular bulb, and that's the internal jugular vein right there. So these two diagrams is a overview of the entire venous plexuses in total. So that's the superior, that's the inferior, that's the straight, that's the great cerebral vein, that's the lateral transverse, that's the occipital, that's the IJV, that's the jugular bulb area, that's the cavernous sinus, that's the sphenoparietal sinus, that's the cavernous, that's the superior petrosal, that's the posterior clinoid process. So this diagram is eventually the best diagram for you to understand the orientation and the pathway of the sinuses. Okay, so moving on further, we have the same occipital sinus diagram. You can see this is the occipital sinus, where we could see the inferior anastomotic vein of labia for the transverse sinus over here. Okay, so I hope the concept is very clear. So you can take a screenshot for the occipital sinus. That is the percentage of variation of presence in a particular individual. Now the occipital sinus is nothing but it commences around the margin of the foramen magnum. Now you can see the foramen magnum through which the spinal cord passes. So you can see the foramen magnum in somewhere in this area. So by several small venous channels, one of which joins the terminal part of the transverse sinus over here. Okay, it communicates with the posterior internal vertebral venous plexus and ends in the confluence of the sinuses right here. Now it may be present in 64.5% of cases. It may be single, it may be double, it may be having a left occipital sinus, it may be having a right occipital sinus. So it may be present on one side, it may be double on the other side. So there are a lot of variations you can see. So this is all about the venous dural sinuses. Now the last thing I want to show you is how the dural venous sinuses looks like on an MRI venography. Okay, so this is a case I have of a patient where you can see this is the MRI venography, where I'll just zoom this for you. Now I can rotate this in a 3D anatomy. Now this is the anterior aspect, this is the posterior aspect, this is superior, and this is inferior. Now as we all know, this is a superior sagittal sinus, right? This is the inferior sagittal sinus, right? That's the great cerebral vein, right? That is the straight sinus, that is the confluence of sinus, that is the transverse sinus, that is the sigmoid sinus, and this is the internal jugular vein. So see how basic, if we clear our basics in the anatomy, so even on the MRI venography, you'll be able to, identify the venous sinuses. So if I rotate this further like this, so if I rotate, it makes this now, this is the anterior posterior view. So this is the midline as we saw, this is the midline superior, then the inferior, then this is the inferior, then the straight sinus, leading into the confluence of sinus, and then this is the transverse sinus. Okay, as you can clearly see, the lateral one here is the transverse sinus, and then coming anteriorly to form the sigmoid sinus over here. That's the sigmoid sinus right there, and then eventually it forms the IGV. So as you can see, there's something extraordinary in this patient's MRI scan, is that the left transverse sinus is completely absent. As you can see, the left transverse sinus is completely absent, and directly here you can see the proximal part of the sigmoid sinus, and then there's a faint margin of the IGV over here. So there's a complete absence, or you can say obliteration, of the transverse sinus over here. The same thing you can see over here, that's the transverse sinus, which is completely absent. Same thing over here, you can see the transverse sinus is completely absent in this patient. So as you can see the same sagittal section: superior, inferior, great cerebral vein, straight sinus, confluence of the sinuses. That's the transverse sinus, that's the transverse sinus, that's the sigmoid sinus. And as you can see, this is the superior petrosal sinus, very faint. See, this is the superior petrosal sinus, that is the inferior petrosal sinus. Here I think it is going almost towards the jugular bulb, and that's the IGV right there for you. So that's the anterior, that's the posterior. So this is how you can study the dural venous sinuses on an MRI venography. Okay, so I hope this video was really helpful for you guys, and if you have any queries, any doubts whatsoever you want to learn in the head and neck region, just post your doubts in the comment section, and I'll be glad to reply to all of your comments out there. So till then, take care, see you, thank you.